Doctor, could you just tell us what does nephritis even mean? A lot of times these medical jargons can really scare the living
Yeah.
daylights out of us patients. And
Yes,
how
yes,
does
exactly.
over to you, doctor?
Nephritis, basically, these are all medical jargons, as you have told. They are like quite complicating. Any ITS means there is some inflammation. That's what is the basic meaning of its. Is, for example, you have thrombophlebitis. There is some inflammation there, or you have something called any its is a inflammation or some sort of. Just to make it more simple, it is some sort of war going on between two things. That's inflammation, or some sort of an aggression between the host, that is the body is trying to fight out something which it thinks is foreign, it doesn't belong to the body. So that's what is happening. So when these things happen in the brain, it is called cerebritis. When this thing happens in the heart, it is called myocarditis. Similar thing, if this thing happens in the kidney, it is called nephritis. By definition, cerebrum is, or cerebellum, whatever, these are all parts of the brain, and myocardium is heart, and nephron is the kidney. From there, the word comes nephron and itis. They both go together. There is some sort of inflammation, some sort of fight going on inside the kidney. And this fight can be of various categories. It can be routine street gruel, somebody is shouting and all. So in such things, or it can be a street fight, or it can be a really gun warfare. It can be anything. So that's what nephritis is. And that's how it's classified. The severity of nephritis depends on how the kidney really reacts to it. So we'll discuss that shortly. But just to describe more about the fight, what happens is kidney has many structures inside that. I'll get a paper, 1 second. You guys can see this?
Yes, doctor, we can.
Yeah. So basically, this is the shape of a kidney. It's a very beautiful bean-shaped organ. So if there is any fight going on, it becomes reddish in color and there is some sort of a fight. For example, if a mosquito bites your hand, a small sort of a reddish spot will come over there. You may even scratch over there. Similarly, if this disease called lupus or many other bacteria that can cause inflammation inside the kidney, if such things happen, then the kidney also becomes reddish in color and it starts leaking protein and blood cells. That is the only way kidney can react. And third thing, the way it can react is it can react like a turtle. It can just go inside its, that shell and hide. So it shuts down. So that is represented by the rising creatinine. So these are the only three ways a kidney can react. And that's the level of nephritis which can happen. Yeah, I think that's more simple.